Welcome to our Healthy Communities podcast. I'm Dr. Phil Huang, Director of Dallas County Health and Human Services, and we're welcoming you to our first episode today, where we'll be discussing the COVID-19 pandemic and what we experienced during this impactful event that affected all of our lives. And today we're really fortunate to have Judge Clay Lewis Jenkins, who's really responsible for emergency response in Dallas County. So thank you for being here, Judge
Oh, it's
Jenkins.
great to be here. Thank you for having me.
Yeah, so it's sort of hard to remember back to what we've gone through. But what do you remember about some of the early days and early stages of the pandemic?
I remember being thankful that you were our Health and Human Services Director. That's one thing. We were fortunate. Both of us were fortunate because we got to go to Washington, D.C. right at the beginning before any cases got here and visit with people who had those first few cases in New York and in Sonoma County, Washington. Visit with the health directors in your role who dealt with that. And I think what we both saw early on was that this thing was very contagious. It was going to move very quickly through our community once it got here. And so we made up our minds to try to get ahead of it.
Yeah, I remember monitoring the situation. We're seeing what was happening in New York and Italy and China, and then when we were still anticipating our first case. I remember some of those. There were these sort of persons under investigation and having to figure out what we're doing. But one of the things you did early on also is brought together some local experts for sort of a public health advisory committee for that. Remember your thoughts on pulling that together? And
I thought, a couple of things. One, I thought it would bring about a consensus of the community, and it would, the more minds we get together, the better the thought would be. And so bringing the infectious disease doctors from the big hospitals together who know exactly what's happening at their hospital and the capacities at their hospitals, I thought would be helpful to us. I remember we also brought together business leaders, critical infrastructure leaders, faith leaders, a whole host of people to deal with the various facets of the early time of COVID. But I think bringing those folks together not only helped us to make better decisions because we had more data points, but also helped people to say, well, I don't know Clay Jenkins and I don't know Dr. Wong, but I know Baylor Hospital. That's where I had my babies. And if the doctors at Baylor say this, maybe I'll believe that. Or UT Southwestern, Methodist, what have you, Parkland. So, I think it helped on a lot of fronts.
Yeah, no, absolutely. And it was really such a great resource for our community. Also, in particular, I remember you're bringing together some of the faith leaders that I think had a big impact throughout. I remember that some of them were really vigilant about not having services and promoting the messages and prevention throughout this.
Yeah, I think the faith leaders were really helpful, and not just in the decision of whether to have services, but for instance, early on when our justice of the peace were trying to figure out what do we do with all these people who are suddenly not working, can't pay their rent, should we evict those people? It was the faith leaders several times who wrote letters to our JPs, multi-signature letters asking them, please don't evict families during this public health crisis. They listened to that. And ultimately, the Supreme Court came in and said, you can't evict these people. But we were the first county to stop those evictions because the judges agreed to it. So they did that. And then you and I had both worked on the mass critical care plan. And we saw, which for the listeners is the plan of what you do when you have more people needing a medical resource like ventilators than you have ventilators. We wanted to make sure if that were to occur, if we were to have a situation where there are 500 ventilators but 5,000 patients, that those ventilators would be, assigned in an equitable way, in a fair way, in a way that follows public health and leads to people having their best chance at survival. And so the faith leaders, we briefed them on that, and they were helpful in getting that, helping with that message. Ultimately, thank God we didn't have to ration ventilators, but making sure that people were in the know on that and saw that it wasn't being done in a racial or socioeconomically unfair way.
Yeah, and I remember the County Medical Society was really engaged with that. Dr. Casanova was sort of working on some of that and working with the community. And yeah, no, that's a great,
Yeah.
great example. But so, as we started to then, I remember when we had our first cases and then starting to anticipate and seeing the numbers increase. I mean, what was going through your mind or what were you thinking? Because I know we had some of the conversations with the other municipalities and those mayors and things.
Yeah. I think the thing that was going through my mind is get there early, right? Get there before this thing gets out of control. And so we were the first county, as you know, to limit crowd size. And it almost seems um, quaint or ridiculous when you think about it. I pulled together all the mayors and city managers, and I said I'd like to limit crowd size. I can't even remember what it was, to like 100 people outside. And that only lasted a day before we were on to the next thing. But even that first thing, people were like, "Well, that's ridiculous. What about big weddings?" You know. And then when we shortly thereafter, we had to close restaurants and bars and say to people, but you can have takeout and all these different ways to keep getting your food from there. And the pushback on that. And then probably 2 weeks later, you saw the public catch up to what we were seeing behind the scenes and saying, yes, we need to not go to bars. We need to do these things. And then within that, we never shut down critical infrastructure. So as you know, critical infrastructure is defined by a federal act. So there are some things that are considered critical, like grocery stores, and some things that are not considered, critical, like beauty salons. And so if it was on the critical infrastructure list, it was open. And if it wasn't, then for that brief time, it was closed. And we had to pull together business leaders in those sectors and the critical infrastructure sectors and in some of the sectors that weren't open, and also workers and labor leaders, because we had to help the businesses keep the groceries going to people. We had to convince and help the workers not get sick and believe that their place of work would be as safe as it could be for them. So there was just a whole lot of collaboration that you and I had to oversee early on. It seemed like just almost like constantly going from one Zoom to the next.
Yeah, and thinking back to that also, I mean, we were in a very different place. There was limited testing. We had no vaccines.
Yeah.
There was, no treatment out there and people you'd see, dying. You'd see the halls of the hospitals in some places filled and, really worrying about that
Yeah.
coming to our own community. Fortunately, we never saw it get to that level, but certainly the burden that was the potential and just really people were dying in those hallways in the hospitals and we didn't have any other tools besides this, so it was very different. But also I remember one of the things that really sticks in my mind at that time, you said that you want to be able to wake up in the morning, 2 years from now or a couple years from now, wake up in the morning, look in the mirror and be able to look yourself in the eye that we did the right thing.
Right.
And I think that was always sort of driving what was going on. And I appreciated your leadership and everything on that during that time.
And I appreciated yours. And I think the right thing was pretty clear to people. Early on, everyone knew what and I say everyone, maybe not everyone in America, but the broad consensus of political, business, economic, thought leaders, as well as, of course, medicine, were to do things to control the spread of the virus. I think it wasn't until probably there was an incident where there was a hairdresser that refused to not be open during the time hair salons were closed. And the governor, had rules, as did we, that the hair salon couldn't be open. And the president began to tweet at the governor And at that point, you began to see that a tweet that the lady was being mistreated, that the hairdresser was being mistreated. And the result of that is where you really began to see that first schism, not just with a few rogue businesses that thought they were better than everyone else and knew best and just wanted to stay open no matter what. But you began to see that schism in politics where um, pe- people's decisions, at least some decisions, seem to be more poll driven than public health driven. And I think one of the things that we did so that we could look in the mirror is our decisions were driven by public health. So we didn't have polls. We had doctors from our major hospitals and our friends, outside of even the Metroplex at the National Institute of Health and other places, telling us what the data looked like, making decisions on the data as opposed to making decisions on the polls. And I think that was prudent because when you make decisions on polls and the poll says people want to go drink beer in a bar, and this actually happened, if you remember, here in Texas. And so they opened the bars back up. People start getting really sick. We didn't have a vaccine yet. Deaths started dramatically increasing, and they had to shut bars back down. So the poll might have been 1 month, open up bars and let's all drink beer together. And the next month it might be, why did you open those bars? My husband is in the hospital. So always sticking with public health. Not that public health is always going to be right. I can't really think of a time when it was majorly wrong during this pandemic, but to me, it just made sense. Let's trust the people that have trained their entire adult lives to advise us in this moment and to care for us when we're sick with these diseases, as opposed to trusting the groupthink of people who aren't doctors or, a political poll.
And that is what was, tragic really about it, that it became so politicized and not just based on the science or public health, but the science was evolving too. And that was something that I think was hard for the public sometimes to understand, that, early on didn't know about a lot of things.
Right.
There were no tests available, but more information came, and that did sometimes lead to some changes in what we knew,
Right.
how it was transmitted, how easily transmitted, and all those things. But let me, there's so much more we could talk about sort of at those early stages, but let me jump to when the vaccine finally became available. And I remember it was like, right before Christmas, I think. And first, the state and the federal government were saying, okay, we're going to use all the pharmacies and get all this out through that mechanism. And then they said, oh, no, we decided we can't get it out as fast through that way. So we're going to do these mass vaccination clinics. And that we had a week to try to set those up, set up waiting lists, get people on board. And there was still limited availability of vaccine. It's, started out in the hospitals. But remember back to that time, and what were your thoughts there as we were sort of moving forward? And I know we then started with looking at Fair Park.
Yeah, I think one of the things I looked at there is a recognition that we have, just as we have food deserts, we have healthcare deserts here in Dallas and Dallas County in North Texas, and wanting to get the vaccine to the people in those, at least at these mega centers, to the people in those deserts, those people least likely to get it, but most likely to need it. It's always that the most, aggressive, and I don't mean aggressive in a negative way, but the people who find a way to get what they want, they're going to find a way to get that vaccine. We certainly saw that with people sneaking into line at our vaccine site. But that 75-year-old who, if he or she gets it, it could be deadly at that point. We wanted to make sure to get them into a place where they could come and get it. And so when we started that, I remember we started with people that I believe were 75 years old and older, and then dropped it to 70 and 65. And we were looking at those vulnerable zip codes. I remember our partner Luminaire was coming up with ways to send out invitations, but as quickly as they would, people who were, say, 40 years old and healthy would find ways to break the code and get in line. So that was a bit of a challenge. And I remember early on the car lines being very long, and Toyota Process Improvements and others coming in to help us speed that up. Um, we, as a federal site, uh, the I called the then chief of staff, Ron Klain, an hour after Biden took his oath of office. Ron had been the Ebola czar when we handled the nation's first Ebola outbreak here in Dallas, and we had remained friends. And I asked him to consider getting us one of these mega sites. In their negotiations with the governor wanted to split the sites, have the Dallas site be half sized so there could be part of it in Arlington and part of it in Dallas. So we end up getting only half as many soldiers as the other mega sites. But because of your friendship, for instance, with the chief pharmacist at Kroger's, because of our paramedics and our firefighters and our Dallas County Medical Society doctors who would come out and work after their shifts at the hospital were over, we were able at Fair Park to give more shots than any other site, even though we were a tier 2 site, half as big with the federal resources. We were able to give more shots than any other mega site in America. Something I'm very proud of, because each of those shots represents a person who has a much better chance of surviving COVID. One thing also to remember, people may say, well, you did all those things and I got COVID anyway, or I got the shot and I got COVID anyway. Here's what you have to remember. Early on, Dr. Wong and I were trying to, if you remember the phrase, flatten the curve. We were trying to keep as few enough people getting COVID and filling up those ventilators so that we wouldn't have to ration care and people wouldn't have to go home to die. And that happened because less people got it because they were separated from one another early on when we had no tools. And then for people who got the vaccine and still got COVID, because that is, possible, what we know is you're much less likely to have that serious outcome if you're vaccinated. And so we were very pleased to do that. And if I could say one thing to the public now, it would be to stay current on vaccines for the flu, for COVID. Right now, if you're over the age of 65 and you haven't had a vaccine in the last few months, it's time to get the new vaccine. You don't need it for the young people. CDC is not recommending it. But what we know is over half of our hospitalizations are senior citizens. So let's make sure to protect ourselves if we're that age, or our loved ones if you have loved ones that are over that age.
Well, definitely that experience at Fair Park and the mega site was memorable. I mean, we were
Yeah.
living out there for months on end, I remember. And, I grew up going to the state fair. I never will see the place the same way since
I
that
know.
experience. But also, I mean, yeah, it evolved and, really became what we got to where we saw over 12,000 people in one day
Yeah.
through the site. And, those early days, I remember again when the vaccine was all just available and people were crying, sort of just
Yeah.
thankful for being able to get that vaccine. I just remember so many of the people saying, "Oh, I've been had to stay home and not been able to see my grandkids or family, and now this was sort of this thing that could free up people," and it was quite an amazing time, really, to go through that. And,
Yeah, it really was. We go into these jobs in public health and public service to help people, right? We don't want bad things like this to happen, obviously, but if it does, we want to do our best to help you. And so I know for me, and I think for you too, we'll be able to look back at this years from now and see it as, if not the highest point of our public service, then certainly right up there. Um, I think we're probably still in the PTSD stage of all the stuff that happened there. But as we move away from it, what we're able to see is a team that got together, and not only the internal Dallas County team, but the people who volunteered and came to help. They came together to really help their community, and it's something that I think our whole area, whole county and city and North Texas can take a lot of pride in.
Yeah, I mean, again, looking back, it was just this incredible experience to have to go through that we've all gone through. But,
Yeah.
I mean, if there's anything that's come from it, I mean, we've certainly developed more capacity, capability, experience in dealing with these. I know from some of the data standpoint,
Yeah.
at the beginning, we literally had stacks of paper faxes that, people were getting these lab reports, and we had UT Southwestern med students manually entering
Yeah.
this stuff. And now we're getting systems, so it's electronically reported. We can get it real time. And, all this
Yeah.
information, everything was so critical. And, was, I say, trillions of dollars worth of policy
Yeah.
decisions were being made on public health data. And so we're hopefully getting these investments to keep these systems running. Our capabilities of, if we had to, heaven forbid, stand up another mass vaccination
Right.
clinic, we've got that experience. And
Yeah, I think one of the advantages of this, and I'm proud of you. You just went to collect an award, a Smart Cities Award, for the great work that we're able to do now in disease tracking through your Dallas County Health and Human Services team and your partnership with large, what is it, Salesforce and Accenture, I think, on that one. But one of the things, the good things that came out of this is companies all around, like Salesforce, Accenture, Luminaire, et cetera, they all focused on public health. They're like, okay, here's what we need to worry about right now. And so we've gone in very short time since the first day of COVID from fax machines and paper faxes, which you'd hardly see anywhere else but doctors' offices in 2020, to this state of the art computerization, where we can use artificial intelligence, sampling of wastewater, um, groupings of supercomputers like at Parkland Center for Clinical Innovation to really drill down and find things that human beings with paper would take a long time to find. But with these computer programs, we can find much quicker, get to the problem much faster. Even during COVID, I remember some of the early things that you implemented, Dr. Wong, to find where the hot spots were, right? So we were limited on a whole early on PPE even, and then later on vaccine. And so if you could see that there is a hotspot in this, area or in this business or in this neighborhood, then we could put our resources towards that and keep that from spreading. And not only help that neighborhood or that business, but it helped what those were connected to. Because if you've got a big outbreak, let's say in Pleasant Grove, the people in Pleasant Grove that are essential workers are going to be traveling to places that aren't in Pleasant Grove. So we need to contain that and help those people and find them quickly. You're able to do that. And now it's even much better with these computer advances.
And then also our community outreach team. That's another thing that we were starting before COVID and really have developed. And we've got these partnerships doing these pop-up clinics in the community, working with the various pop-ups and making these services,
Yeah.
vaccines, testing and things available out where they need to be, where people don't have as much access, which is something that we're definitely continuing post-COVID to keep.
Yeah, and that pays off on trust too,
Mhm.
because as people have more trust for public health and for health and human services, then they may be more likely to listen to us, to people who are 75 years old and have never gotten a flu vaccine. And when you're of a certain age, flu's no fun to have when you're 18, but when you're a senior citizen, flu can be deadly. And so if they'll now listen to us and let us give them that free flu vaccine, that is a life-saving thing for them. So I think that's been great. And it's great. I was here the other day, as you know, for an event about vaccination. Brought my mom over, who's over 65, to get her COVID booster, and saw the vaccine of several people from the senior center, as well as an Mpox, high-risk person for Mpox. And just seeing Barbara and seeing some of the team, it really is like we all went to high school together. You see, we went through it.
Yeah.
So,
Yeah. I mean, and that's one thing, it did impact us all personally. I mean,
yeah.
any reflections back on that or?
Yeah, it was obviously it was very, very tough, personally for all of us. I know It was tough in my life, and we had sacrifices in my family. One of the things I was thankful for is early on, one of the groups we pulled together was a mental health group, and included Metro Care and some psychologists and psychiatrists because we knew this would be a long deployment, right? Ebola had been really tough, and that was 30 days, 32 days. We knew this would be longer. And so we looked at how do we keep ourselves in the fight? Because if you're not going to win the fight against COVID if you can't stay in the fight. And so the first four things that they told us about, I think, were pretty, intuitive, right? Get sleep, eat, get some exercise, spend some time with people that you love. And the last two weren't necessarily, but I found were really helpful. Approach everything in a spirit of gratitude as opposed to what you're, upset about that day or disappointed about that day. And then spend the first 15 minutes of the day thinking about the kind of person you want to be before you dealt with those, problems that you knew would be there, the second you wake up. And so I thought that was, helpful, but it was, a huge sacrifice for a lot of our folks personally. But we also recognize that there's a huge sacrifice out there beyond us, the sacrifice of people who lost a family member to COVID. Or the child who, like my own daughter, who instead of starting high school with her peers, high school was shut down when she started. And even when she went back, hardly any kids were there. And so that, it was tough on kids. It was just, tough on everybody. And we continue to see those after effects and try to help those people. I don't think that, for instance, our mental health crisis with our young people started with COVID, but it certainly was exacerbated by the isolation around COVID.
Yeah, and looking back, incredible experience that we've all gone through. Any final comments or thoughts?
I'm very thankful for you and the team and the great work that y'all did. And I'm very thankful for the community here in North Texas. And by and large, the community in North Texas listened to what the doctors and the scientists said, did the things that they needed to do to protect themselves and to protect their families and their neighbors. And it was a real honor. It's hard, but it was a real honor to lead that response, both with the internal team and for the people of North Texas.
Thank you, Judge Jenkins, for everything and for sharing these incredible experiences that had such an impact on our community.
Thank you, Dr. Wong, for your leadership and your friendship.
So please subscribe to our channel or watch for more episodes of our Healthy Communities podcast. Again, this is the first one that we've had, and we look forward to seeing you next time.